We'll be covering the human pelvis, legs, and the human feet. So let's start with the pelvis. When you put your hands on your hips, you've got your hands curved around a part called the iliac crest. This is the ilium. This is the iliac crest. So when you carry your child on your hip, or when you put your hands on your hip, you have it on the iliac crest. When we move anteriorly, you'll feel a bump of bone. It's called the ASIS. That stands for Anterior Superior Iliac Spine, ASIS. When we go posterior to that iliac crest, we come to another block of bone back here, and this is called the Psis, Posterior Superior Iliac Spine. And when you look at the, especially for females, when you look at the skin externally, sometimes you'll see two indentations, two types of dimples, and that shows you where the PSISs are located. As we move inferior on this hip, we get down to another crater. This thing is called the acetabulum. This forms a ball and socket joint that we call the hip. The ball part is the head of the femur. The femur is the largest bone in the lower extremity. And the head of the femur fits directly into this acetabulum, forming a diarthrotic joint, which means it's a freely movable joint. This is a ball and socket joint. When we move anteriorly and inferiorly, we come to the pubic bones. The pubic bones have a fibrocartilage disc, which forms an amphiarthrosis, a slightly movable joint. We don't want this joint to be freely movable, like the ball and socket diarthrotic joints. We don't want it to be immovable, like the synarthrotic joints of the skull, where we have the sutures. We want it to be slightly movable, so it is stable and yet flexible enough to deliver a baby. When we move posterior, we have two bumps of bone back here, and you can put your hands under your bum and you can rock back and forth, and you can feel those blocks of bone. Those blocks of bone that you sit on are called the ischial tuberosities. It's part of the ischium, ischial tuberosities. So this is ilium, this is ischium, and this is pubis, iliac crest, ASIS, PSIS, ischial tuberosities, acetabulum with the head of the femur, pubic bones with the pubic symphysis. As we move distal to the hip joint, we're going to get down to the knee joint, and we have a patella here, P-A-T-E-L-L-A, patella. Some people call it the kneecap. We have two bones of the lower leg. The medial bone is much larger. It's called the tibia, T-I-B-I-A. The lateral bone is much smaller. It's called the fibula. Be careful not to meld those words. Students sometimes call it fibia or tibula, and that's very incorrect. Tibia on the medial side, that's your shin. That's what you usually hit when you hit the coffee table. So that's your tibia. The lateral side is the fibula. So when we look at the ankles, the ankle is not one bone. The ankle is actually two bones. We have the medial ankle, or the medial malleolus, is the distal end of the tibia. The lateral ankle, or the lateral malleolus, is the distal end of the fibula. Just inferior to that, we have a group of bones called tarsals. Calcaneus, which is your heel bone, is one of the tarsal bones too. Don't forget that one. So these are the tarsals, including the calcaneus. The middle of the foot are called metatarsals, and the toes are called phalanges. Remember that fingers are also called phalanges, and it's spelled with a PH. So in review, we have the phalanges, metatarsals, tarsals with the calcaneus joins with the Achilles tendon, tibia medially, fibula laterally, medial malleolus, lateral malleolus, patella, femur, head of the femur, acetabulum, pubic bones with the pubic symphysis, iliac crest with the ASIS and PSIS, and the ischial tuberosities.